Hi, everyone. This is Jen from HR at O'Connell Care alongside Mike, our HR generalist at O'Connell's. And we wanted to jump on to give you guys a quick update and to check in on a few things COVID related. I know it's been a little while since Mike and I have been on here, but we feel like with the upcoming holiday season and the subsequent uptick in COVID cases across the country, we felt compelled to jump on here and update you guys about some workplace protocols and also just some general guidance around COVID for the upcoming months as we all venture in the cold weather months ahead of us. So, we wanted to remind everyone, I know you've heard this a million times, but it's worth repeating again. What we like to draw back to the 3 W's of COVID, which is always to wash your hands first and foremost frequently in your home life. When you're at the client's home, continue to wash your hands for 20 seconds at a time. Wear your mask always, of course, while you're with your clients, but also recreationally when you're out and about in your personal lives. Respect yourself, respect others around you, and throw that mask on. There's still a mandate in Massachusetts to wear your mask. So hopefully everyone is still doing that. That's the number one thing that we can all do to stop the spread. And the third W is to watch your distance. You have to social distance pretty much everywhere you go now, whether you're outside or indoors at a facility. Everyone needs to remember to keep 6 feet, at least 6 feet apart. So wearing a mask, washing your hands, and watching your distance is something that we're going to continue to ask you guys to be diligent about, not only at work with your clients, but also in your home life too, especially in these next couple of months with cold season coming around. So please, we're going to ask you guys to be extra diligent now, just like you were a couple months back when COVID started. This is not the time for us to press pause and to put our foot on the brakes with COVID. We all want to be extra diligent and extra vigilant going into the holiday season. So speaking of the holidays, I know a lot of you plan to travel for the holidays and have traveled in the past for Christmas and Thanksgiving and whatever other holiday that you celebrate. Unfortunately, 2020 looks a little different than every other holiday season. So this year we all just sort of have to come around to the idea that our holiday seasons and our family gatherings are not going to look the same. And even though you might get that temptation to go see a loved one, whether it be across state or across country, there still is a travel policy in place here in Massachusetts. And O'Connell's is still abiding by that travel policy. So as of today, the travel policy has been updated with a few more safe states. So now there are 10 safe states on the Massachusetts Safe Travel COVID list. And those safe states are California, Connecticut, Washington, D.C., Hawaii, Vermont, Maine, New Hampshire, New York, New Jersey, and Washington State. So if you do decide to travel, which we strongly discourage travel from any place outside of these 10 safe states. But if you do on your own fruition decide to travel to a state other than one of those 10 states, as of today, you would be quarantining when you come back. So that 14-day quarantine order is still in place, regardless if you have a negative COVID test when you come back from traveling. O'Connell's is still going to advise you to quarantine. In November and December, this travel list could look a lot different. Right now, there's 10 places that you can travel safely to without having to quarantine when you come back. However, in November and December, if there's a big surge in COVID cases, like the scientists are predicting, then I have a feeling this list is going to diminish down to the 4-5 states that we started with back in May and June. So as of today, you have 10 places you can travel to. We are still strongly discouraging travel. We want to be really careful with the rate of transmission when you come back to work with your staff, your clients, and we have to do everything in our power to protect you guys, our own staff, and our clients from the effects of transmission. So we will give you guys another update in November if there was a change to the travel policy at all. My feeling is that if anything, it's going to become a little bit stricter and you're going to have a lot looser guidelines and parameters around the number of states you can travel to. But for now, it's those 10 states. And by tomorrow, Mike and I will be sending an update so that you have the updated safe list state. You can also jump on the mass.gov website and click on travel order if you want to go ahead on there and see the map as it is now. Before I hand it over to Mike, I just wanted to give you an update about the O'Connell's workplaces and how we're treating O'Connell's and taking all the extra precautions in the offices. We are still around 50% capacity in all of our 5 offices. You generally won't see more than 1 to 2 people in each office. Some offices are bigger, so they might have 3 people there, which is still at their 50% capacity, but we are still limiting traffic in our community offices. That doesn't mean we don't want you guys to come in for PPE. We still want all of our aides to come and get whatever they need to get. You just might not see everyone in the office when you do. So gloves, hand sanitizer, masks, we have what you guys need at the office level. We might be running a little bit low on hand sanitizer in some of the offices, but we're working on building that shipment back up. So please, if you do come to visit the offices, be respectful of the social distancing and the COVID measures that we've taken. Always put your mask on when you come into the office, maintain a social distance, and if you can, call or knock when you get here so that we expect you at the door. So I want to end with just saying, please continue to wear your masks, please continue to social distance, and please continue to wash your hands and hand sanitize now through the end of the winter months so that we can all get through this spike that they're predicting in the winter safely. And I don't have anything else to add, but I'm going to hand it over to Mike. He has about 5 minutes of updates for you guys too.
Yep. So we're going to transition from our offices into your guys' office, which is the client's home. So we want to make sure that when you guys are in your client's home, especially as cases are on the rise, that not only you, but our clients are being kept as safe as possible. And the best way we can do that is to probably be using the PPE that Jen just talked about. Make sure that we are wearing our masks at all times in the client's home. You guys have all been provided with face shields and eye protection. So please make sure that you are wearing that when applicable when working with the clients, and also wash your hands on a very consistent basis. These 3 things can really help prevent the spread of the virus, as well as keep our clients and yourself safe. And we just want to remind you too that inside the offices, we have the PPE that you guys need. We have the masks. And as Jen said, when it comes to hand sanitizer and other things, just make sure you call ahead and see where we're at with our supply. We are doing our best to keep them as updated as possible. And particularly as we are coming into the winter months and as travel might be tougher to get to and from our offices, just make sure that you are stocked up on backup supplies, backup masks in particular. As you guys see with those surgical masks, those ties break all the time. So just make sure that when you're going to our clients' homes, just have a couple backups on hand, just so you can make sure that you're appropriately abiding by our expectations while you guys are there. And then going into the winter months, we can transition into flu season. I know I've been sending a bunch of messages out about Flu Shot Friday. You might be getting tired of hearing about them, but we just want to remind you again about the importance of receiving a flu shot as recommended by the CDC, as well as other healthcare organizations. The flu in particular this year can also cause an uptick in the spread of not only the flu, but the COVID virus itself. So we are strongly encouraging that you guys look into getting your flu shot. We have actually partnered with Big Y Pharmacy. So if you guys are in need of a flu shot and need to know locations of where to receive one, please reach out to us at hr@o'connellcares.com or call your office directly. We'll be happy to get you the flu shot and point you in the nearest pharmacy that you can receive one. So as always, guys, just remember to be vigilant, be safe, use your best judgment. We've been doing this. We're not going to stop now, unfortunately. And hopefully together as a team, we'll just be able to, keep on, trucking through this situation. You guys have all been doing a great job, and we can't thank you enough for all of your hard work and dedication.
That's absolutely right. Thank you, Mike. And we will continue to post updates on our Facebook page now until the duration of the COVID life cycle. So continue to like and engage on our Facebook page and check your ClearCare messages. We will be continuously sending messages and updates out over the next couple of weeks to help you guys get through these tough winter and holiday months. And as Mike said, If you need anything from the HR perspective, please give us a call directly in the South Hadley office or send us an email at hr@o'connellcares.com. We hope you guys are all staying safe. Thank you for everything that you've done and continue to do every day. And we will check in with you guys soon.
Bye, everybody.